Welcome to Think Like a Nurse 2. This is our lecture 4. We're going to continue our discussion on the urinary system and urinary disorders. And our primary focus for this lecture is regarding the actual urinary assessment itself. Okay, when we think in regard to our client in determining what's going on with them, we already talked about our signs and symptoms, but we also have to collect data in regard to our nursing responsibilities for these clients. So what we're looking at, things that are very important, is going to be COCA, C-O-C-A, COCA. Okay, color, the C stands for color. So we're looking at the color of the urine. Some some different types of colors that we may see are a clear to straw color, which is actually a normal colored urine. Next, we could see a tea colored urine or slightly amber colored urine. We could also notice a urine that is kind of a green to a brown, which could indicate that the urine contains bile or another substance. And we're also looking at whether or not the urine could be a bright red or pink or rose color tone, and that could indicate that the urine has a fresh blood in it. Depending upon the location of where the blood came from, that can also change the consistency or color of the urine. Okay, our second is our O, color. We're noticing odor. And we talk frequently about the different, using our senses to help us collect data. Well, determining the odor of the urine, is it fruity? Is it sweet? The fruity or the ketone urea, or that fruity smelling urine, typically comes from clients that are diabetic. So we're learning how to take our sense skills and apply that to our data collection on our clients. So we've talked about the color, we've talked about the odor. Also, the odor could be very foul smelling. It could have the odor of feces or other bacteria. And usually our saying is, if it stinks, it's not good. So generally, if you do smell urine that has a foul odor to it, that can indicate the presence of bacteria. And also the contaminants such as feces or what else may be present, nitrates or nitrites in the urine that we talked about, I think in lecture 1, that would be abnormal as part of our collection within our urinalysis or urine culture and sensitivity. Okay, and then we're looking at our additional C, color, odor, consistency. We are inspecting that urine because that's what we do is we inspect, and as nurses we have to be good detectives to be able to look at all the different things that our urine is actually providing for us. So our consistency of the urine, is it thick, is it thin, does it contain any granules or sediment? Is there any pus or debris that's contained in that urine? This is going to be a very important assessment because in our next lecture we're going to talk about renal calculi and or the presence of calcium or crystals that are contained in the urine that indicate that there may be an obstruction or development of renal stones or kidney stones. So assessing that urine is going to be extremely important. We're also looking at our amount, and what we mean by the other A in amount, A-M-O-U-N-T, amount is the volume. We're looking at that urine volume because the volume that a client or the amount of urine that a client puts out within a given amount of time is going to be very significant in helping determine whether or not their kidneys are actually functioning appropriately or as they should. So normally we don't want urine to be under, or we don't want a client to put out less than about 30 milliliters of urine per hour, because if they go under that amount, then that means that there is a significant decrease in that function of the kidney. The client may have other metabolic problems going on that may indicate a decrease in the urine, or the client may be holding a lot of fluid or having a lot of fluid retention in a condition such as anasarca. So we're looking over the body for the generalized edema. We're trying to find reasons why a client may not be putting out enough urine. So ultimately what we want to know is, yes, they are putting out at least 30 milliliters of urine or 30 cc's of urine within every hour, or that their I's and O's are equivalent. Their intake is equivalent to their output. So that's going to be very important when we're looking at their hydration, whether or not they're taking in any PO fluids, if they're on any PO restriction, whether or not they're taking in any IV fluids or additional irrigation of the bladder. Those kind of things are going to be very important in determining our quantity or our amount or volume of voided urine. These are some very important things that you need to keep in mind, because our urinary assessment ultimately is what's going to guide us in determining which way we need to go as far as whether or not we make nursing decisions on our own, those independent nursing actions, or whether or not we need to consult our healthcare provider or another specialist to help with our client, because ultimately there may be a dysfunction. Again, thank you so much for joining me on Think Like a Nurse 2, and we'll continue with our next lecture on urinary disorders, and that's going to include our renal calculi and other obstructions of the urinary system.